Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Darren Rizzi, Mississauga's Fire Chief and Director of Emergency Management, Sam Rogers, our Director of Enforcement, and today, I'm happy to have a special guest join us to speak about COVID-19 vaccines for children and youth, Dr. Lawrence Small, Medical Director of Infection Prevention and Control from Trillium Health Partners. I want to start off by acknowledging that today is the International Day for Elimination of Violence Against Women and Girls. Sadly, more than 1 out of every 3 Canadians has experienced physical or sexual assault. This is a tragedy, and it is unacceptable. We must do more to ensure the safety of all of our women and girls in our community. By recommitting ourselves to eliminating gender-based violence against all women. Tonight, we will light the city's clock tower orange and raise MBrave's flag high to not only raise awareness, but to encourage Mississauga residents to think about what they can do in their daily lives to make a difference in our efforts to eliminate all forms of violence against women and girls. We must stand together. And now for my COVID-19 update. As many of you know, we are entering a new phase in our efforts to protect the gains that we've made and keep Mississauga healthy and safe. I was pleased to hear that Health Canada approved the vaccine for children aged 5 to 11, and that Ontario will be receiving enough supply to ensure that every eligible child can receive their first dose. The region of Peel is in a good position, and I'd like to thank the province and the federal government for working together to ensure the swift delivery of the vaccine. By the end of this week, Dr. Lowe expects to receive half of the first doses needed to vaccinate the roughly 120,000 children aged 5 to 11 here in Peel, with over 60,000 appointments available just for this age group in the next 6 weeks. We don't anticipate any issues finding appointments. I want to thank the parents here in Peel who have stepped up and already booked nearly 10,000 appointments through the Ontario COVID-19 vaccination portal. Our fixed clinics in Peel are starting to provide protection to children tomorrow. And as vaccine supply increases in the coming weeks, appointments for the 5 to 11 age group will also be available in pharmacies, community clinics, school-based clinics, and with primary care providers across the city. I want to thank our littlest heroes, and of course their parents, for taking this step to not only protect their health, but the health of all Mississauga residents. We know that kids aged 5 to 11 have the highest COVID-19 infection rates in the region, and about 1/3 of Ontario's COVID-19 cases are now being found in school-aged children. While children may experience milder COVID symptoms compared to adults, there is a small percentage that develop long-lasting effects or severe symptoms which require hospitalization. Opening up eligibility to ages 5 to 11 without a doubt will help protect our children's schools and the wider community. I know that some parents may have reservations, and for children, getting a needle can be scary. That's why I've invited Dr. Lawrence Small here today to address these concerns. As Dr. Lowe says, the region's smallest residents have been some of the biggest heroes of the pandemic. Kids have had to deal with so many disruptions to their day-to-day life, and now that the vaccine is here, we're asking them to step up and do their part too. To those who have already made their appointments, thank you. You are helping increase community protection, reduce the severity of the 4th wave, and keep our numbers stable. And now I want to provide you with a brief update on the overall situation here in Mississauga. we are growing closer to reaching our goal of having 90% of all residents 12 plus fully vaccinated. In fact, nearly 86% are double vaccinated. Hospitalization numbers are also starting to stabilize. This is good news. What is a bit more concerning is that cases in Mississauga are slightly up this week, and that our reproductive rate, that R factor, is above 1 at 1.2. And this means that for every one person infected with COVID, they will pass it on to at least one other person. This is not a trend we want to see, especially as the cooler weather arrives and we start making plans to see family and friends during the holidays. As we approach the holidays, I encourage you to continue to do what you can to stop the spread, such as wearing your mask indoors when gathering. I'm hopeful that by opening up the vaccine to this new age group, our city will be even better protected going into the winter months. That being said, I encourage anyone who has yet to make an appointment to please do so. All of this progress is allowing us to slowly get things back to, allowing us to get back to the things that are important to us and coming together as a community, just as we did last weekend here in Mississauga when we lit the tree in Celebration Square, our first official event in the square in nearly 2 years. Let's keep the momentum up so we can continue to celebrate the many holidays in December and kick off 2022 with a bang. On that note, we continue to do everything in our power to get things back to normal and get our businesses back on their feet, which is why my council approved an extension to both the temporary patio and temporary outdoor business programs until December 31st, 2023. This will help ensure businesses can not only offer outdoor dining year-round, but also continue to be creative with how they use outdoor spaces, help them maintain the momentum they've built, and provide them with some certainty in the coming years. I, for one, look forward to seeing holiday, craft, and night markets popping up all over the city in the weeks and months to come. Mississauga, we are on the right path. Let's keep it up. And with that, I'd now like to invite Dr. Lawrence Loh to give his update.
The opportunity to provide this update. As of this week, Mississauga's COVID-19 case rates are currently at 22.1 per 100,000, with a test positivity at 2.5%. Across the region of Peel, we are now closing in on 90% first dose coverage of our 12 plus population with 1 dose, and 85.7% of our 12 plus population have received 2 doses of vaccine. This week, along with health units across the province, we have begun to deliver vaccinations to help protect our 5 to 11 population, our little heroes who have shown such resilience throughout this pandemic. As a parent with a child in this age group myself, I urge all other parents to get our little ones vaccinated without delay. While severe outcomes amongst children are rare, they have occurred in Canada. Inflammatory syndromes have landed little ones in intensive care, and other children have experienced long COVID symptoms long after their acute infection has resolved. At this juncture, because this is a new disease, it's still not completely clear which kids are at risk of these rare but severe outcomes. The vaccine, by comparison, is effective in protecting against these outcomes with only mild side effects. That means a favorable risk-benefit profile and certainty and protection for our little ones, which is the primary focus of this campaign. We also know that the vaccine provides greater certainty in preserving in-person learning and also in gatherings with family and friends. That will allow a reduction in risk of infection and transmission between children and also reduce exposures and outbreaks, especially in schools, where elementary schools continue to be our biggest driver of school-based outbreaks. There is no doubt that getting vaccinated is a game changer for our children. It will help to restore certainty in their interactions in schools with family and friends, and is also a game changer for all of us by remaining the risk and susceptibility in the last large high contact group within our community, and keeping all of us safe. When the announcement of the approval came out on Friday, I wept briefly knowing that my little one could now access protection. And for that reason, I ask all parents in Peel, please do not delay. Let's get our children protected as soon as possible so that we can all move forward with greater confidence together. I also want to urge everyone who is 12 plus who is not yet vaccinated. It's still not too late. The vaccines also protect you from severe and mortal outcomes. As we see our 5 to 11 population get more protection, we get closer and closer to endemicity and the exit from the acute phase of the pandemic. If you remain unvaccinated and uninfected, the disease will remain as novel to you today as it was in January 2020, with no certainty as to how your disease course will fare. It's likely that our community will only continue to become more and more open in the coming months as we restore confidence with the vaccination of our 5 to 11 population. So I urge you, please, if you are eligible at 12 plus, don't take the chance of severe and mortal outcomes and do get vaccinated today. I also urge everyone who is eligible at this point in time for a third dose booster, i.e. 6 months since your second dose in accordance with provincial guidance, to please also access that as we are moving into the winter respiratory season. And finally, for all of our residents, I ask for your continued vigilance as we continue with our campaign to protect our 5 to 11-year-olds. We can all do our part to keep rates low by continuing to mask indoors and in crowds as much as possible, complying with certification requirements, and to keep those who are unvaccinated safe. And finally, by staying home and getting tested if we are sick, even in the slightest. Let's keep our children safe and learning by remaining vigilant with precautions and by getting them doubly vaccinated, as well as doing our part to do the same if we haven't already. Thank you, and I'll pass it back to you, Madam Mayor.
Thank you, Dr. Lowe. And now I'd like to invite Dr. Lauren Small, Medical Director of Infection Prevention and Control from Trillium Health Partners, to speak about vaccines for children and youth. Dr. Small.
Thank you, Mayor Crombie, for having me here today. As you said, I'm Dr. Lauren Small. I'm an infectious diseases physician, Medical Director of Infection Prevention and Control at Trillium Health Partners, from where I'm joining you today. Firstly, I want to thank this community for your incredible support throughout the entirety of this pandemic. As one of the hardest hit regions from COVID-19, we've made tremendous progress to reduce the spread of the virus and its effects. We've come so far since the beginning of the pandemic, and we could not have made it to where we are today without the ongoing efforts of the entire community to help reduce COVID-19 transmission and keep us all safe. To date, 89% of Peel residents 12 years and older have received their first vaccine dose, and 85% are fully vaccinated. As an infectious diseases doctor, I continue to care for patients with COVID-19 in the hospital. Trillium Health Partners has seen patients of all ages with COVID-19, including children. We know through rigorous scientific evidence that COVID-19 vaccine is the #1 defense against this virus. This is also proven by the number of COVID-19 hospitalizations and deaths we see in the hospital from those who are unvaccinated or not fully vaccinated. While we see COVID-19 hospitalization and mortality rates decline because of increasing vaccination rates, our overall goal is for everyone who is eligible to get vaccinated. Now, after thorough scientific review of the evidence and recommendations from the National Advisory Committee on Immunization, Health Canada has approved the use of a lower dose of Pfizer's COVID-19 vaccine for children 5 to 11 years old. In the United States, the Food and Drug Administration has also approved this vaccine for children 5 to 11 years old, and to date, over 3 million children within this age group have received the vaccine in the United States. Currently in Ontario, we are still seeing significant numbers of new COVID-19 cases, and 10 to 20% of these cases are occurring in children. While children are at lower risk of hospitalization and death from COVID-19 as compared to adults, they can still transmit the virus to higher risk groups, especially unvaccinated adults or those with weaker immune systems, such as the elderly and immunocompromised individuals. Vaccinating children who are eligible will reduce the spread of COVID-19 to these groups. As an infectious diseases physician who has seen the impact of this deadly virus on thousands of patients over the last 2 years, my best advice to everyone who is eligible to get the vaccine is to do so in order to protect yourself and your loved ones from the continued spread of this virus. We understand you may have a lot of questions about vaccinating your children or family members, and we encourage you to speak to your doctor. As a father of 2 kids myself, I can relate to wanting to do everything possible to protect our children. I can also relate to the fathers, mothers, and children I've seen in the hospital diagnosed with COVID-19 and the pain it brings, thinking that could be my own family. My wife and I are both physicians. We got the vaccine as soon as we were able to. Both our children are over 12 years old, and they both received the vaccine when they became eligible. If we did have a child who was age 12 or as young as 5, we would get them vaccinated now that they would be eligible as well. Within our community, we are seeing the positive impact that increased vaccination is having on our lives. We're able to see our families and friends again, go to restaurants, and see our kids playing their favorite activities. But now, with more people being eligible to get vaccinated, including our younger population, we have the opportunity to increase vaccination rates and work together to live safely in an era of COVID-19 and put the pandemic behind us. While vaccination is our most powerful means of protection against COVID-19, we also know that other public health measures, such as masking and physical distancing, are additive in their protective effect. It is still important to continue with current public health recommendations to protect ourselves and our loved ones. As we enter the flu and other respiratory virus season, I would also encourage everyone to get their yearly influenza vaccination to further reduce illness in our community. The more we are vaccinated for COVID-19 and influenza, along with continuing to follow public health measures and recommendations, the safer we will be in the coming months and the new year. Thank you. I'll turn it back over to you, Mayor Crombie. Thanks.
Thank you, Dr. Small. And now here we are with Dr. Lowe, Dr. Small, Chief Rizzi, and Sam Rogers, and we are happy to take questions from the media.
Our first question is from Steve from Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
I'm so very well, Steve. How are you this morning?
I'm okay. Thanks for asking. My questions are actually for Dr. Lowe.
Yep, no problem. Okay. I'm sure he's still on the deck. Dr. Lowe, over to you.
Go ahead, Steve. Thank you, Madam Mayor. Go ahead,
Hi, Dr. Lowe. Hi, I wanted to ask about the Spatman video that was taken down by Appeal Health kind of after it was published. Can you understand that it was taken down basically because it had become a bit of a distraction and negative kind of perceptions were attached to it? Can you kind of elaborate on what the reaction was and kind of what's your kind of how this video came about in the first place, and what the goal of it was?
Yeah, thanks so much for the question, Steve. Indeed, one of the videos that we used to launch our Appeal, Superheroes Kids campaign did receive a significant amount of attention. Out of an abundance of caution, we recognized that it was becoming a distraction from our primary focus, which is really about getting our 5 to 11 population protected. So as a result, that video was taken down. We continue to be focused really on trying to communicate to parents the direct benefits that children derive from getting vaccinated, 5 to 11, and focusing our communication messages on really answering parents' questions and making sure that they have the confidence they need to know that they are absolutely making the right choice for their children, for their families, and certainly for our community as well.
Thank you. And just another one on that, and perhaps just a quick second follow on that. Can you, would you say at this point, like the tactic of kind of using a superhero kind of in this way was perhaps a mistake based on how some parents may feel about vaccinating their children? Just the second part of there, I think Mayor Crombie mentioned there's 10,000 appointments that have been booked for 5 to 11. Is that kind of what you expected at this point, or what kind of early numbers were you kind of anticipating for kids' appointments?
Well, Steve, I think we've had a really significant increase in draw around parents that have been interested in getting their children vaccinated. I think all the cities. I mean, certainly, I know our partners in Toronto are also speaking to the little heroes that our children are. I think that is a broad theme that is permeating all the various local health unit campaigns. So I think, like I said, we remain focused on moving forward and getting our children vaccinated. That is our priority. This is more than just one video. This is about getting our 5 to 11s protected and getting out of the acute phase of the pandemic. But I thank you for your interest in your question.
Thanks, Steve. Any follow-up?
I think he had two already.
Our next question is from Natasha from The Pointer.
Welcome, Natasha.
Mayor Crombie.
Yes, good morning.
I went through the city's capital budget programs yesterday, and I was looking for programs related to climate change. And I noticed that there was very few programs that had to do with retrofitting buildings. And I know that that specifically was for city buildings. Sorry, this is a very long before my questions. However, we know that 50% of carbon emissions come from every sort of building in the city.
Right.
So my question is, does Mississauga have any sort of financial capability to fund an initiatives program for residents to retrofit their homes, or is it dependent solely on upper level governments?
Yeah, that's an excellent question. And we are in our budget discussions right now, and we are working very, very hard to mitigate all the deficit positions we could find ourselves in as a result of lingering effects of COVID over the second year, particularly as they relate to our transit shortage with ridership being only about 60%, et cetera. So we're doing what we can not to increase tax rates to anything over about the rate of inflation. So unfortunately, at this time, such a program does not exist other than for upper levels of government. And you can well imagine that that cost could be quite onerous and not one that a city the size of Mississauga or any municipality could bear, Natasha. We have our own climate change goals and our own climate change action plan that we have been implementing, and I'm very proud of those initiatives, but at the residential level, that would be a burden of the individual homeowner.
Okay, sounds good. My second question is for Chief Rizzi.
Certainly. Chief, invite her up.
Go ahead with the question.
So I noticed, again, another budget question. A few of the projects in the capital budget are for replacement of fire vehicles and a new fire truck. I'm wondering if any of these vehicles are electric.
No, at this point in time, we have not proceeded with electric vehicles. So out of 31 front-run trucks, we have managed to purchase 19 replacement trucks in the last few years. In our 2022 budget, we will be purchasing 4 fire apparatus. We certainly have looked at the fire apparatus, the electric fire apparatus, and we engaged in discussions in, I would say, June time. And we know that this is a big topic of conversation because Brampton and Vancouver are in a race to have the first electric fire truck in Canada. But when we did a lot of our investigation, obviously it's quite an expensive truck. And what you need to understand about fire apparatus is they're quite technical. So not only the maintenance part of a fire truck, it's also the tactical considerations. And let me be clear, these fire apparatus, they're not solely electric. They're all dual, right? They're diesel fueled and they're also electric. And right now, the vendors are on their 3rd iteration of battery, and each battery is $250,000. And certainly, while it's very important, this is the future of the fire service, 100%. But we're trying to debate the financial feasibility versus being the first to bring out a electric fire truck, because we do anticipate there will be challenges that will need to be overcome with this new technology in the fire service world. And so when we started looking at this in, I would say, June time, because of these announcements, other vendors were also, demonstrating their technology, and you would have to sign an NDA, a non-disclosure agreement, to be able to see how these other vendors were going to overcome these challenges. And with procurement rules, it doesn't look very transparent when you're going behind closed doors to get that information. So when that information is publicly available, we certainly will start engaging in more fulsome conversations with all the vendors to take a look at that technology. Certainly it is on the horizon. We do understand that this will be the future of the fire service, but we don't necessarily think such a very big investment. We want to be the first to come out to get that electric vehicle.
Thank you. We'll bring the mayor back up. Yeah.
Thank you,
Our
Natasha.
next question.
Yep.
Our next question is from Declan from Mississauga News. Go ahead, Declan.
Welcome, Declan.
Crombie, how are you?
I'm so well. How about you? Hope you're doing well as well.
I'm great. Great, thank you. You had mentioned that COVID cases are slightly up, and that's a concern. Is that due in any part to the specific areas of Mississauga that you had previously mentioned as as having lower vaccination rates?
Right. You know what? I'm going to ask Dr. Lowe to comment on this as well, but I think more specifically, we saw gatherings increase towards the end of October with Halloween. Then we saw certain festivals like the Diwali Festival and a number of other cultural festivals that occurred in that month in October and November, and I think they drove case counts up slightly. The good news is that hospitalization rates are stable, but I'm watching the R factor, that reproductive rate, very carefully. It's under 1 across Peel, but it's 1.2 in Mississauga, so that does give me cause for concern. And I would like Dr. Lowe to speak specifically about those neighborhoods, because it is Peel Public Health that is monitoring those neighborhoods. Dr. Lowe?
Yeah, thank you so much, Madam Mayor, and thanks for the question. So just to clarify, and I mean, Mayor Crombie has basically spoken to it largely, but there's a number of different factors that are leading to, the slight increases. It is important to note that this is not a sustained increase, that overall in the region of Peel and in Mississauga, numbers do remain largely stable at this point in time and are anticipated to improve once our 5 to 11 vaccination and booster campaign continue to reach more people with protection. I think there are a number of factors, including just the loosening of restrictions that occurred almost a month ago. Also, the colder weather. Now that we're indoors, there's more indoor interactions starting up again. Those neighborhoods where there is lower vaccination coverage certainly do continue to drive cases, and we do see many outbreaks in schools and in community venues in those specific areas of the city. And it's for that reason we are actually opening another vaccination clinic in southeastern Mississauga at the Sheridan Mall, which is available for booking at peelregion.ca/COVID-19 vaccine. Right now, really focused on getting that last mile, 12+, but we anticipate it will eventually be joining the rest of the fixed clinics and providing 5 to 11 vaccinations as well. But our focus again really is trying to bring up vaccination coverage rates in those communities. So I think the changes in weather, the loosening of restrictions, certainly the festivals and gatherings that Mayor Crombie identified, as well as the relatively lower. I mean, they're still high, but high in absolute numbers, but relatively lower compared to the rest of the region coverage in South Central and East Mississauga. All of these factors have contributed to what has been just this recent rise. But again, we do continue to see overall stability and would certainly highlight any sort of sustained increases or exponential growth in cases, as well as any sort of changes in our hospitalization picture, which also does remain stable at this time. Thanks so much for the question.
And Declan, if I may add.
Do you have a follow-up?
Sorry, I just want to make a comment, Mallory. Thank you. To Declan, 1/3 of all new cases are in school-aged children as well. So that's why it's so important that parents consider having their 5 to 11-year-olds vaccinated at this time. Next follow-up, please.
Yes, thank you. Just with respect to the restaurant patios and the extension to the end of 2023, and I know there's the possibility that it could also be become permanent. What specific concerns or issues would have to be looked at before that could be made permanent?
Let me just say this.
Is parking a concern, traffic?
Yeah, exactly. All those things, as you would expect, certainly. But this has been a very successful program. And all of the restaurateurs and business owners I have spoken with love the program, as I know they do in Toronto as well. So this is there is a momentum to keep this in place. And I, got to say, I've enjoyed the outdoor patios myself. So it's great news for our city. It makes it very dynamic. But that said, of course, it does create parking, traffic, and congestion concerns. So, and encroachment on parking lots. So these are some of the, the ebbs and flows, the gives and takes that we'll have to wrestle with. But right now, I know that all the restaurateurs really appreciate the program, and as our residents do as well. I think they've enjoyed the patio experience that has come with this new program, and we hope to keep it in place. But we'll be dealing with that in the months to come at Council.
Thank you. That concludes the questions for this morning.
Thank you very much for joining us today.